Hey Freedom Lovers, this is Dr. Peterson Pierre with America's Frontline Doctors bringing you today's Daily Dose. For over a decade and a half, the medical community has grappled with a paradox in cardiovascular health management. Statins, the widely prescribed cholesterol-lowering drugs, while undeniably effective in lowering cholesterol, do little to reduce heart disease risk and cause significant side effects, including an increased risk of type 2 diabetes. A groundbreaking study published in 2024 in The Lancet has now provided the most comprehensive evidence to date on this connection, confirming and expanding upon findings first hinted at in earlier research, including the landmark Jupiter trial from 2008. This new meta-analysis conducted by the Cholesterol Treatment Trialists collaboration delves deep into individual patient data from multiple large-scale, long-term, randomized controlled trials. To fully appreciate the significance of this new research, it's essential to look back at how our knowledge has evolved since the Jupiter trial first raised concerns about statins and diabetes risk. So in 2008, the Jupiter trial, Justification for the Use of Statins in Prevention, an intervention trial evaluating rosuvastatin trial involving over 17,000 participants, was designed to evaluate the efficacy of the statin drug rosuvastatin in preventing cardiovascular events in individuals with normal LDL cholesterol levels but elevated high sensitivity C-reactive protein, which is a marker of inflammation. The trial's primary focus was on cardiovascular outcomes. However, quote, buried within the cardiovascular data was an observation that the rosuvastatin group showed a higher incidence of physician-reported diabetes, end quote. This finding raised important questions about the long-term metabolic effects of statin therapy. Fast forward to 2024, this study represents the most comprehensive examination of the statin diabetes connection to date. By analyzing individual participant data from 23 large, long-term, randomized, double-blind trials, the researchers found a dose-dependent nature of diabetes risk. The longer you've been on statins and the higher your dose, the greater the risk, ranging from 10 to 36%. Statin cholesterol-lowering medications are among the most prescribed drugs in the US, but they can cause serious adverse effects, even beyond diabetes. The most common and well-documented adverse event is muscle-related symptoms, ranging from mild muscle pain to severe rhabdomyolysis, meaning muscle cells are actually dying. As far back as 1977, with the publication of the Framingham study, no correlation between heart disease and total cholesterol could be found. That was almost 50 years ago. Quote, further, while statins are primarily prescribed to lower LDL cholesterol, some experts argue that insulin resistance, not high LDL, is the primary driver of atherosclerosis, which underlies many heart diseases, end quote. Research published in scientific reports also found a significant association between long-term use of anti-cholesterol drugs, primarily statins, and an increased risk of pancreatic cancer. There's also concern that statins increase cataract risk by interfering with cholesterol biosynthesis in the lens. If statins worsen insulin sensitivity while lowering LDL, they're doing little to address the root cause of cardiovascular disease. This suggests that strategies focusing on improving insulin sensitivity and reducing oxidative stress may be more effective in preventing heart disease than lowering LDL cholesterol. It also raises questions about the widespread use of statins, especially in light of their ability to increase diabetes risk. Yes, that's all fine and dandy, but Big Pharma has money to make. And you know that's always going to be the driving force. Ladies and gentlemen, only the truth will set you free. Stay tuned for the next Daily Dose.